So we can also analyze our claims to identify the prevalence of some of the chronic illnesses that we target with our various disease and care management programs. And so we've done that here, and this again shows your 2007, 2008 prevalence of some of the common chronic illnesses compared to the aggregate, and then the variance from the aggregate. So your prevalence of diabetes last year was about a little more than 3%. That's slightly higher than the aggregate of 2.8%. Your prevalence of depression was 13%, a little bit lower than it had been the prior year, and slightly higher than the aggregate. Your prevalence of rare and chronic illnesses, which is a collection of 14 chronic illnesses that individually are rare, but together are not that uncommon and are all very expensive, is a little bit higher than average at 0.54% compared to the aggregate of 0.45. That includes things like the most common diagnoses in that group are rheumatoid arthritis and multiple sclerosis. Includes other things like lupus and Parkinson's and things like that. You have a fair amount more asthma than the average, which is a little surprising because usually asthma is seen mostly in seen more in populations with a lot of kids, and this group, you don't have a lot of kids, or you have fewer than average number of kids. But in any case, you have about 6% prevalence of asthma, and the aggregate's around 4%, so you have a somewhat higher average there. Chronic obstructive pulmonary disease, COPD, your prevalence is just slightly higher than average. This past year it came down from the prior year. And then you also have somewhat more heart disease, 2% of the population with coronary artery disease compared to 1.8 or 1.5 in the aggregate. So again, somewhat more chronic illness in general in this population than we saw in the aggregate, and that's consistent with the group risk score finding.